Time to talk about the important side effects of NSAID. In the previous lecture, we have already discussed about the NSAID comparison, and here's a quick mnemonic which you can use. Try to remember all the NSAID in sequence. That is, the all intelligent nerds keep important pain notes documented and carefully explain pain, nerve, muscle problems. You can use your own mnemonic, but remember it in sequence. It will be much more helpful in upcoming lectures. Right, after talking about the important side effect of the NSAID, we will focus all of these drugs individually. So let's start with aspirin. Aspirin causes the Ray's syndrome, which is the swelling of liver, particularly in children and adolescents age group are much more prone to have this disease, particularly after a viral infection. In this, there will be right upper quadrant pain along with metabolic acidosis and tinnitus. Right. Next is ibuprofen. Ibuprofen is highly nephrotoxic. So nephrotoxicity. And because of this fluid retention, we'll focus only on the most important one. Okay, there are also some other side effects. We'll not focus on that anymore. The third is the naproxen. Naproxen is highly cardiovascular, highly cardiotoxic. Cardiovascular toxicity is extremely high in this case. So cases of thrombus, clots, stroke, stroke, etc. are much more common with the naproxen. However, a single dose won't cause all this, but prolonged uses with high dose will have a higher risk, right? Next is ketorolac. If you remember the ketorolac over here, right, it was having the highest risk to cause the gastric bleeding among all the NSAID, right? Yes, aspirin also causes, but ketorolac has slightly higher edge to causes this thing. So in the aspirin, yes, of course, Ray's syndrome is there along with gastric bleeding, but it is much more, or we can say highly, it is most ulcerogenic NSAID. And it is also nephrotoxic. Next is indomethacin. Indomethacin is CNS toxic. It can cause the headache, dizziness, and confusion. There can be also some other side effect. Propafenazone. Propafenazone is only the drug which act on bone marrow also. So it can cause bone marrow suppression. Right. However, it is a rare side effect. The nimesulide, it is banned in most of the countries, many countries, even I don't know why, but nimesulide, it is still in action in India. It is highly hepatotoxic, right? This is the only thing you should know, and it is banned in most countries. Next is diclofenac. It increases the liver enzymes. And the patient using diclofenac are at higher risk. That is a cardiovascular risk. So thrombosis, MI, so and so. Next is aceclofenac. Same stuff over here. Okay. That is along with cardiovascular risk also, right? Plus, there's one better thing that we must know, that it has a better GI tolerance. While talking about the side effects, try to keep this table to your side. We were at aceclofenac. See, it has slightly lesser risk than the diclofenac to cause the gastric bleeding. So overall, better GI tolerance. Number 10 is celecoxib. Celecoxib and etoricoxib will do it together. Both have higher risk. Though it was having a lowest risk among the NSAID group to cause the GI bleed, but still it has a higher risk for thrombosis. So again, MI, stroke, etc. MI, stroke. Also hypertension can be seen in even low doses. So patient who is having such drugs will have palpitations, maybe, right? Will have a heavy pounding of heart, and because of this, patient might not even feel well. Right, the next is paracetamol. Paracetamol is quite safe drug, but like after reaching like 4 gram per day, right? So we'll talk about every drug in much more detail. Right now, just remember paracetamol after a specific range, it is highly hepatotoxic. It is even contraindicated in patients who are having liver issues. So hepatotoxic at toxic or high dose, particularly like 4 grams per day. Next is nifopam. Nifopam has CNS side effect. So confusion, increased heart rate, hallucination, delusion, so and so are much more common. Let's write it together. So hallucinations, confusion. At high dose, they can also seizures, which may occur. They can also be increased heart rate, right? Because of the sympathetic action, right? Next is the mefenamic acid. Mefenamic acid, mefenamate. It causes the abdominal pain. Abdominal pain. It can also cause cramps, and it can cause diarrhea. And for prolonged use in females, it can cause hemolytic anemia. Why females? Because this drug is actually used by females a lot. And lastly is the piroxicam. This is among the worst NSAID to cause the GI bleed. So worst GI bleed. Piroxicam, see, it was the highest to cause the GI bleed. So remember all these 3 and 4. Let's write one more, plus high GI bleed, right? And the piroxicam also, GI bleed is much more bad. So remember, for the paracetamol, okay, till 4 gram per day, it is still tolerable. Let's write it over here for the specifically paracetamol, right? Paracetamol, it is safe if it is consumed like less than or equals to 4 gram per day. You can have about like 500 mg, 8 tablets, okay, still you will be fine. After that, it is hepatotoxic. Hepatotoxicity start with the range of 7.5 milligram per day, okay, not milligram, it is 7.5 gram per day. And lastly, it is fatal, right, if it is given like 15 gram per day. Like, so it is about like 500 milligram tablet, 15 tablet all at once, okay. There is one antidote, okay, antidote which you should know, and most of the examination they used to keep on asking this question. Antidote for PCM is N-acetylcysteine. Remember this, N-acetylcysteine, very very important. Right, so this was about the important side effects. In the next video, I'll talk about all of these drugs individually. We'll first talk about aspirin, then ibuprofen. I'll try to make an individual video on all of them. Like that, the video will be much more shorter and it will be much more interesting. Right, so yeah, important side effects of NSAIDs.